We recently had the pleasure of talking to Rob Williams, president of Williams Health Group and owner of Performance Posture Group. A kinesiologist, posture specialist, and movement coach, Rob writes a health and fitness column for a national media chain and is a guest contributor to several magazines and blogs. A much sought-after expert, Rob works with a diverse clientele, including professional and Olympic athletes.
I'm Rob Williams, and I'm a kinesiologist. I've been practicing about 20 years now, and throughout my career I've really decided to focus on posture and alignment. What I found was the majority of my clients that were coming to see me had muscle imbalances, had asymmetries or injuries that could very easily be related to misalignments, imbalances in their body. A big part of identifying those weaknesses or imbalances comes down to an individual's foundation. You know, they may have a misaligned pelvis, they may have issues up through their spine, their lumbar spine, their thoracic spine, into their cervical spine. And those things all need to be addressed, but at the same time we need to take a look at how their feet are functioning, how their foundation and their structure meets the ground, and how those forces are transferred up through the body, which is where I've really developed an appreciation for the importance of the AFX when we do identify people who have dysfunction or weakness down through the feet, the lower legs, to be able to specifically target, isolate, correct, and address those weaknesses or those dysfunctions, and have that flow into this total care that we apply with this individual to rebalance and realign their whole bodies. Quite often it's fairly common to identify either on one side or bilaterally where an individual hyperpronates. They just have a collapse at one foot due to a lack of functional strength throughout that foot, throughout the intrinsic muscles of the foot, you know, or even into the lower leg. And that is a fairly common presentation where when we do have a collapse of one foot, what will end up happening is we'll have a drop on that side through the pelvis. And when the pelvis drops on that side, the asymmetrical forces will start to cause that pelvis to torque or rotate. That torque or torsion or rotation can actually make what's already a bit of a leg length discrepancy caused by that foot that's broken down, and it can amplify that pelvic unleveling. When that happens, we get even greater forces, asymmetrical forces through the body, which can cause, you know, knee strain, isolateral knee strain, medial knee, lateral knee, cause problems with, the IT band, the hip joints, certainly cause spinal issues when we get the pelvis is dropped and then it's, torqued or rotated. It affects the sacrum, which then affects the lumbar spine, and as you can imagine, when we get those imbalances, often they'll magnify as they go further and further away from the body's center. One of the things about the AFX that I find, is really superior to other methods of strengthening the foot or the ankle or the lower leg is the ability to isolate specific movements, the ability to apply progressive loads for the specific muscles. When we actually start doing foot exercises, and you've got fixated joints or weak muscles on one foot versus the other foot, and the only application is do barefoot toe raises or barefoot walking or pull a towel or do some resistance band exercises. It's so hard to isolate and identify the weaknesses. So when strengthening the feet, we want to be able to do similar resistances on one foot to the other foot. We want to create balance. We want to be able to balance the loads and the resistances between specific muscles and specific movements of the feet. And just by doing some basic TheraBand exercises, left side, right side, there's so much room for compensation and error that you can identify. So in any good strength and conditioning program for athletes, the ability to apply these very carefully selected progressive loads on all the other muscles of the body, it's just as important, if not more important, through the feet and the lower legs. And that's probably the key factor of what I find with the AFX is you can be that scientific and that progressive and that accurate with what you're trying to do. And in my posture clinic and in my training studio, we're constantly educating our clients and our patients is about the importance of foot strength. Now, so many people have braced their feet for a long time. I'm wearing shoes right now that are very good supportive shoes. I spent a lot of years wearing orthotics, which effectively braces my feet. Now, there's a purpose for that, and there's times where that is necessary. But if you do that constantly, we know what ends up happening is we end up getting atrophy of all of the muscles of the lower leg. The example that I use is that if you don't train the muscles in your feet, you end up with a bag of bones at the bottom of your leg that could be giving you power and helping you to absorb shock and load if it was fully conditioned, just like what these athletes are doing with the rest of their body. If the feet aren't conditioned and they're just braced or supported, with these supportive shoes all the time, the deconditioned feet actually become, power dampeners as far as the ability to explode big, powerful legs, but driving through a foot that just collapses. I think on the AFX website they have an image of the foot with all these great core muscles, and the first time I saw it I thought, well, that's great, because the importance of that structure at the bottom of your leg is as significant as the core and the support for the pelvis and the spine. And when people get that and they take that seriously, is when they really start to move like athletes.